Myasthenia gravis is an autoimmune disease, which means that this type of disease occur when the antibodies that are produced in our body to fight against foreign antigen behaves aberrantly and start attacking the proteins that are present in our body proteins. This protein can be any enzyme or any receptor, any membrane protein or any other protein, but those body proteins. This type of autoimmune disease, they are very common in old age, and in fact rheumatoid arthritis, multiple sclerosis, these are very common autoimmune disease. And other common autoimmune diseases are Graves' disease, Addison's disease, and lupus. In fact, singer Selena Gomez, she was suffering from lupus, and this our topic, that is Myasthenia gravis, is a very rare autoimmune disorder. And this generally affect the neuromuscular junction. As the name suggests, this neuromuscular junction, there is a weakening of the muscles and other symptoms that are related to this neuromuscular weakness, junctional weakness. Hello friends, I am Dr. Ayantika Das, and in this video I am going to discuss about the Myasthenia gravis, the symptoms, why it occurs, that is the cause, and how to diagnose it, and what are the remedial measures for Myasthenia gravis, and what are the other autoimmune disease that are related with Myasthenia gravis, or the diseases that are often mistaken as Myasthenia gravis. Also at the same time, I will be solving one GSET question, and we know that GSET is very near. It is in the first week of November. So let's begin the video. This is the GSET question that I was talking about. That is, Myasthenia gravis is primarily caused due to disturbance in the blood pressure or adrenergic receptor or cholinergic receptor, or due to kidney failure. I'll be discussing about Myasthenia gravis, and later on I'll be solving it at the end of this video. So, Myasthenia gravis, it's a chronic, that is long-lasting disease, autoimmune disease that is not inheritable. The most important thing is that it is not inherited, and also it is not contagious, that is, it is not triggered by any infection. It is not triggered by infection. However, if there is an infectious condition, then the disease becomes a bit severe. And also the positive thing is that it is not related to a particular race or ethnic group. In many other diseases we see that people from particular race, they are more susceptible, they are more prone to certain type of disease, but that is not the case of Myasthenia gravis. They occur in all races and ethnic group. Also, it is not a genetically related disease, it is not inherited, and also it is not contagious. This Myasthenia gravis, generally they are found in women who are above 40, and in men, they affect men much later in their life. There is also a variety, that is the Neonatal Myasthenia. This type of myasthenia, it occurs when the fetus inherits this antibodies against this acetylcholine receptor, and this type of neonatal Myasthenia gravis, this which is acquired from the mother, it is very a temporary thing, and it disappears soon after, that is 2 to 3 months after birth. This type of myasthenia disappears. So basically myasthenia is caused due to improper signaling or at the neuromuscular junction. So this is the nerve cell, that is this is the axon of the nerve cell, and this is the muscle cell. So this is the nerve cell and this is the muscle cell. So in this neuromuscular junction, this violet colored, these are the acetylcholine, and this green color, they are the receptor. This one is the receptor that receives this acetylcholine. So acetylcholine is basically a neurotransmitter. So this acetylcholine, when it sits on this receptor, then the signal is transferred from the neuron to the muscle cell. But when this type of signaling is hindered, then we find this problem with the neuromuscular junction and muscle weakness due to improper contraction, and that is termed as the symptoms. Neuromuscular degeneration, that is degeneration in the junction of the nerve and the muscle tissue. This type of degradation due to improper signaling causes weakness in the muscle cell. So this basically the weakness of the muscle, it is manifested mostly in the head and the facial feature, and we have a lot of other symptoms that is due to the weakness, that is hypotonia, where the muscle tonicity of the muscle is lost, and also it affects the eyes, that is ptosis, which is the drooping of the eyelids, diplopia, which is having a blurry or a double vision in the eyes, and in fact this ptosis can be relieved by having some ice pack added on the top of our eyelids. This ptosis can be relieved, and diplopia can be in fact relieved by wearing an eye patch on one eye. And then we have dysphagia. Dysphagia is basically difficulty in chewing and swallowing the food. And then we have dysarthria. Dysarthria is basically weakness in the oropharyngeal region, that is the pharynx is responsible for the voice. So in the oropharyngeal region there is weakness in these oropharyngeal muscles. As a result, there is not proper vibration and we have a very impaired and slurry speech, that is called dysarthria. Also, we have other type of eye problems, that is the ocular myasthenia or ophthalmoplegia, where the eye muscles, they become so weak and sometimes paralyzed that the eye movement is hindered. And this type of ocular myasthenia, it has a symptom similar to the stroke in the brainstem. Also, another acute cause of acute symptom of myasthenia gravis is the respiratory failure. The myasthenia gravis, as it affects the muscle cells, so the muscle, we know that lungs, there is a continuous contraction and relaxation, and in if there is this myasthenia gravis, so there will be improper contraction, as a result of which we can see various type of respiratory failure and breathing apnea. Causes of myasthenia gravis. This is the nerve cell, and this violet colored dots, they are the acetylcholine, which are basically neurotransmitter that is produced in the axonal region of the nerve, and they are released. Here we see that these are released in the synaptic space. This is the synaptic space, this area, and on the postsynaptic membrane we see this green colored receptor that bind to the acetylcholine that is produced in the axonal end of the postsynaptic neuron. And this acetylcholine, when it binds to the green colored receptor on the postsynaptic neuron, they cause the muscle contraction. But we know that myasthenia gravis is caused by the weakness of the muscle. So in this case of myasthenia gravis, it will happen that these acetylcholine will be produced by the axonal end of the neuronal cell, and they will be released in the synaptic space, but this receptor that is present in the postsynaptic membrane will either be blocked by certain antibody, or they will be totally reduced in number. This will be totally reduced in number. So in either case there will be less transmission of neuronal signal. So when there is less transmission of signal from the nerve to the muscle cell, this is the muscle cell and this is the neuronal cell. So when there is transmission is hindered or transmission is very rare, then the muscle contraction will be less. And due to this fact, if there is less muscle contraction, then there will be the smooth muscles, they will gradually become very weak. And in fact, this neurotransmitter, they are actually this antibody that bind to the receptor and competitively bind to the receptor, so that the acetylcholine cannot bind. These antibodies causes 85% of this myasthenia gravis is due to this anti-acetylcholine antibodies. Though there are also many other antibodies and that are against MuSK or LRP4. These are responsible for 10% and 5% cases of myasthenia gravis. Now, this MuSK, which is the muscle specific kinase, and this anti-LRP, which means that is low density lipoprotein receptor, these two, I'm drawing it in a different color. So these antibodies MuSK and LRP4, they are responsible for the synthesis for the production of this receptor. The receptor on the postsynaptic membrane, they are responsible. They are synthesized or helped by in the synthesis by this MuSK and LRP4. So if there is antibodies against this MuSK and LRP, then there will be less synthesis of these receptors, and if there is lesser amount of receptor, then with whom the acetylcholine will bind. So in either case, that is the competitive binding of the antibodies to the receptor or the reduction in the number of receptor, both cases it will lead to reduction in the transmission from the transmission of signal from the nerve to the muscle cell. That is, in this way, the signaling will be reduced. As a result, there will be reduction in the muscle contraction. Also, apart from these antibodies, there is also one problem, that is, in case where the thymus gland, we know that the thymus gland is in the mediastinum, that is in the chest part, in between the two lungs. So the cancer of this thymus gland, it sometimes is responsible for this abnormal misinformation of this T cells. We know that during the maturation of the T cells, they are primed by this in the thymus, and in fact if there is an anomaly, then T cell start to produce antibodies that attack the neuromuscular junction in our body. So basically this occurs when there is cancer in the thymus cell, or there is hyperplasia in the thymus gland. So either case cancer or excessive cell, that is cell division, that is hyperplasia, this type of disease, that is Myasthenia gravis, can occur. So we see that there is two main reasons. One is the production of antibodies against this acetylcholine receptors, and against this antibody against this acetylcholine that will bind competitively to the receptor, and the reduction in the number of receptor in the postsynaptic membrane. So there are many standard remedies, especially these steroids. They are helpful in reducing. We know that steroids are helpful in reducing the immune response. They are very much helpful in reducing the swelling in our body that is caused by infection, and also they are used to act as immunosuppressants. And this is a very important and very strong way to deal with Myasthenia gravis as well as other autoimmune disease, that is use of steroids which act as immune supplements. Another thing is that the cholinesterase inhibitor. We know that acetylcholine esterase or cholinesterase, they are responsible for breakdown of acetylcholine. So these are the acetylcholine that is synthesized in the axon of a nerve cell, and the function of this cholinesterase, not the cholinesterase inhibitor, but the cholinesterase, what it does is that it causes breakdown. It causes the breakdown of this acetylcholine. So if there is a breakdown of this acetylcholine, then what will happen is that despite there is the number of receptor, these receptors, though they are present in high number, but as the number of acetylcholine is very reduced, so there will be less signal transmission. So in order to deal with this type of Myasthenia gravis due to cholinesterase, the cholinesterase inhibitor is used. This inhibitor, many inhibitor like Solaris and this type of inhibitor, they inhibit the cholinesterase, which means that acetylcholine will now be synthesized but not destroyed that much, because we are already inhibiting this cholinesterase, which causes the breakdown of acetylcholine. So by inhibiting cholinesterase, we can increase the number of acetylcholine in the synaptic junction and cause rapid transmission and rapid contraction of the muscle, rapid transmission of the signal and contraction of the muscle. Then another remedy is that thymectomy. The removal of thymus is thymectomy. Earlier we have seen that either hyperplasia of the thymus or by the cancerous growth of the thymus, these T cells, they are misinformed and they produce abnormal antibodies. T cells activate the B cells and the B cells produces these antibodies. So in this entire cascading effect, they are misinformed, so they produce wrong type of antibodies are produced by the plasma cells. So if there is either cancer or hyperplasia of the thymus, then they can be surgically removed. Also, this surgical removal, these alter they reduce the immune response. That is, we know that this is an autoimmune disease, so there is a abnormal immune response, but reduction by surgical removal of this thymus, this altered immune response can be made good. And however, this thymectomy, if there is a congenital myasthenia, which is not an autoimmune disease, it has some other, due to some other effect, then in that case, that is a congenital myasthenia, thymectomy is not that much effective. There are many therapies like plasmapheresis and the plasma exchange, where the antibodies of the patient suffering from myasthenia gravis, it is getting replaced by blood or plasma that is collected or procured from healthy individuals. And in this way, what is done is that the harmful antibodies in the blood is getting replaced by healthy normal antibodies that do not attack the body cell but instead attack the foreign antigen. So by exchange of the plasma, which is called plasmapheresis, this type of myasthenia gravis can be temporarily cured. And one thing I should be saying that myasthenia gravis is a type of disease, and in fact all autoimmune disease, they can't be totally cured, but there are remedies that can help us temporarily. So one of that is the plasma exchange. Earlier slide we have seen that use of steroids and cholinesterase inhibitor, they all help in reducing the symptoms of myasthenia gravis. Another thing is that by application of this immunoglobulin that is also collected from the blood of healthy donors, this immunoglobulin is given intravenously, injected intravenously, and this type of therapy with immunoglobulin is also very effective in reducing the symptoms of myasthenia gravis. Also, monoclonal antibody that are produced artificially, and this type of monoclonal antibodies are also injected also intravenously, and this antibodies, these monoclonal antibodies, they in turn suppress the abnormal antibodies, and they are bring the immune system back to normalcy. Diagnosis of myasthenia gravis. Now we know that in the neuromuscular junction, if we repeatedly stimulate the muscle fibers, then it will develop fatigue, and it will take longer and longer time to get the response. But in myasthenia gravis, if the nerve muscle and the muscle fiber, they are repeatedly stimulated with a small amount of electricity, then they will start producing the symptoms of myasthenia gravis. For example, drooping eyes, then the diplopia, all these symptoms will be starting to show up by repeated stimulation of the muscle. So this is a very first process, that is the checking the muscle strength, tone and coordination. This is the very first step in the diagnosis of myasthenia gravis. Another very important and well-known test is the edrophonium test, where we give injection of edrophonium chloride or neostigmine or pyridostigmine. All these, edrophonium chloride or neostigmine or pyridostigmine, what they do is that they block the activity of choline esterase, and we know that choline esterase, this is responsible for breakdown of acetylcholine. So if we add edrophonium in our blood, so it will block the choline esterase activity. That will mean that there will be high amount of acetylcholine in the neuromuscular junction. So a high amount of acetylcholine in the neuromuscular junction will help in increasing the binding of the receptor with the acetylcholine, but we know that there are antibodies against this acetylcholine, so that will block the receptor. So in this case, though there will be increase in the acetylcholine, but there will be still this neuromuscular, there will be a weakness in the muscle. So that is very much first manifestation of this neuromuscular weakness is the eyes. The eye muscles, they started drooping and all. This edrophonium test is also very rapid and effective way to find out whether a person is suffering from myasthenia gravis or not. The ice pack test, where we just add ice pack on the top of our eyes just for 10 minutes, and if the drooping in the eye, that is which were earlier found, the drooping, if they improved, then this is the very case of myasthenia gravis and not a stroke in the ocular nerve. If there is a stroke in the brain stem where the ocular nerves are there, then also there will be a drooping of the eyelid. But if by this application of this application of this ice pack, that is a cold pack over our eye for 10 minutes, it improves the drooping of eye, then definitely this is the case of myasthenia gravis and not stroke. So another test is that rest. We know that myasthenia gravis, as it is a neuromuscular disease, that is it is improved by resting. So if this type of we know that myasthenia gravis is mostly infested in the facial muscle. So if we just close our eyelids for some 30 minutes, and then we see again after 30 minutes we see the functioning of the eye, that is rotation, and if there is any drooping of eyelids or not. So if this type of symptoms are again becoming absent, then after the period of rest, if this type of symptoms are absent, then this type of test, that is the rest test, it is good for myasthenia gravis. That is, a person is suffering from myasthenia gravis. There are also very important blood tests where the antibodies against these type of receptors, that is the acetylcholine or the MuSK or LRP4, these are the blood is checked for these type of antibodies. And if the presence of these type of antibodies are present, then it is a case of myasthenia gravis. Also, many electrodiagnostic techniques like the CT scan, NMRI, they are used to get the images of the soft tissue. We know that CT scan, they use X-ray, and NMRI use magnetic waves, but the effect is same, that is they are used to get an idea of the health of the thymus gland. Actually, this is for finding the imagery of the thymus gland, this electrodiagnostic techniques. Then another electrodiagnostic technique, that is the electromyography or EMG, and in fact the single fiber EMG, where this is very sensitive in recording the electrical activity of the muscle fibers, and in fact this electromyography is very much sensitive test in diagnosing the myasthenia gravis, where the neuromuscular transmission, the transmission is checked, whether the transmission is hampered or transmission is very much smooth going on. This is checked by electromyography. and it is one of the very key exam for checking this myasthenia gravis. Then there are many factors that can worsen myasthenia gravis, and these are tiredness or fatigue, any type of illness, any type of infection or stress condition like surgery, pregnancy, or the menstrual period time. So these are the factors that aggravate the myasthenia gravis. There are also other conditions like other type of autoimmune conditions like rheumatoid arthritis and this lupus, heart arrhythmia and cancer. These type of ailments, they also increase the myasthenic condition, that is they can lead to any type of myasthenic crisis, that is which is basically much more aggravated condition of myasthenia gravis. And these autoimmune diseases or any type of cancer and all these factors, they increase the symptoms. There are also certain medications, for example beta blockers, certain antibiotics, certain anti-arrhythmic agents, also anesthetics and muscle relaxants. All these type of medications can also aggravate or worsen the problems that are caused by myasthenia gravis. So any person who is suffering from, any patient who is suffering from this type of myasthenia gravis should strictly avoid all these conditions. All these conditions should be strictly avoided by any myasthenic person. There are also certain related disorders, that is disorders that have the same symptoms and as that of myasthenia gravis. One of them is the Graves disease, another is the Lambert Ketone disease. And in fact, these are also antibody related autoimmune diseases. Now about the GSET question, that is the myasthenia gravis is primarily caused by disturbance in the first option, that is the blood pressure. We know that the blood pressure, it affects, if there is a disturbance in blood pressure, it affects the heart, it affects the circulatory system, that is the blood vessel and the heart, but not the facial muscle, the muscle of the neck, the muscle of chest. It is not affected. So the first option, that is the blood pressure, is a wrong option. Then we have two type of receptors, that is the adrenergic and cholinergic receptor. We know that both adrenergic and cholinergic receptor, they are able to bind with adrenaline, non-adrenaline, but while we are talking about myasthenia gravis, the one thing, the neurotransmitter is the acetylcholine, and we know that only cholinergic receptor bind to acetylcholine. So naturally the adrenergic receptor will be the wrong option, and that is the B will be the wrong option. That is, this will be the wrong option, and this cholinergic will be the right option, that is acetylcholine binds with the cholinergic receptor. So if there is a problem in this cholinergic receptor, if there is a problem with the cholinergic receptor, then we will have this myasthenia gravis. The last option, that is the kidney failure. Kidney failure usually occurs due to either heart attack or any problem with liver, any other infection related problem. So these type of problem leads to kidney failure, and this kidney failure is mostly, it is related with the urinary system and myasthenia. So that was all about myasthenia gravis. If you have any doubt regarding myasthenia gravis, write it in the comment section. If you want me to make any new videos regarding immunology, you can also write it in the comment section. If you like this video, please hit the like button and share it with your friends. And please do subscribe, because your subscription, it means a lot to me. Those who have already subscribed, Thanks for subscription, and I usually make videos on CSI and NET and GSET question papers. Also, I make videos on MSc and BSc syllabuses. You can go to my channel and watch other videos that I put in different playlists. Thanks again for watching this video.